While I make every effort to broadcast correct information, I'm also still learning. I will double check all my facts, but realize that healthcare is a constantly changing science and art. One doctor or healthcare provider may have a different way of doing things from another. I welcome any comments, suggestions, or correction of errors. I take no money from supplement or device companies. By listening to this podcast or reading this blog, you agree not to use this podcast or blog as medical advice or to treat any medical condition in either yourself or others, including but not limited to patients that you are treating. Consult your healthcare provider for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the podcast or the website. Under no circumstances shall any guests or contributors to the podcast or blog or any employees, associates, or affiliates of the Boss Body podcast be responsible for damages arising from use of the podcast or the blog. This blog or podcast should not be used in any legal capacity whatsoever, including but not limited to establishing the standard of care in a legal sense or as a basis for expert witness testimony. No guarantee is given regarding the accuracy of any statements or opinions made on the podcast or the blog. Hey guys, it's Dr. Tim Jackson here with another episode of the Boss Body Podcast. I have another very special guest with me today, Dr. Kirk Gair. Dr. Gair uses a combination of low-level non-thermal lasers along with chiropractic, functional medicine, and functional neurology. He's been trained in functional medicine and neurology by Dr. Dadis Karazian and was actually the first person Dr. Karazian ever did a functional workup on back when they were classmates in 1996. He teaches other doctors around the world about lasers and has done clinical research on lasers that has led to an FDA clearance in journal publications. His clients have included Super Bowl and World Series champions, world record holders, national champions, film stars, and everyday people. Welcome, Dr. Gair.
Thank you, Tim. Thanks for having me. I'm excited to be here and share this information with all your listeners out there.
Absolutely. So you do a lot with light, lasers. There's so many different types of lasers out there, from $10 to a couple $100,000.
Right.
So talk to us about the general types of lasers and if you can touch on how they're different from red light therapy.
Sure. Yeah, there's a lot of misinformation out there. I've been using lasers since 2004, so I've been using them for a long time. The doctor who trained me, Dr. Dan Murphy, he'd been using them since the 1980s, and he learned his stuff from the Russian research because they started using them in the 1960s. And by 1974, the Russians were so far ahead of us, they already implemented them as state-sponsored standard medical care. So they were ahead of us. There's a lot of research that they were doing to show which wavelengths and which types of lasers and which types of light therapy were the best. And just so your listeners know, I base things off of research. So like, here's a really good book about laser therapy that talks about the differences between different types of lasers and light therapy. You can see how big this book is. The research alone is all of this in the back. There's over 2,500 studies that are in here. And so everything I'm going to talk about is actually backed up by research studies, because a lot of the stuff you hear out there is opinion or it's twisted types of interpretations on here. So let's talk about light therapy first. Light therapy goes back thousands of years. We know that this was used by ancient people. We know that you can use light therapy for like jaundice. You stick kids under a blue light and that can fix jaundice. Over 100 years ago, Niels Ryberg-Finsen was using red light to treat smallpox, and he also used a violet light to treat lupus vulgaris, which is a tuberculosis infection in the skin, and there was no medication that worked for it. And his treatment with violet light actually cured it and led to a Nobel Prize and a commendation by the Queen. So that started off with light therapy. We still have red light therapy today, which has some great impacts. The difference, though, between lasers and LEDs, if you look at research studies, and particularly if you look at head-to-head research studies, because that's the key point, you'll have a lot of people who will say, oh, an LED is just as good as a laser. There are currently no studies that will support that claim. It does have impacts, but in most of the quality double and quadruple blind studies, you're going to see about maybe a 10 to 20% effectiveness of an LED versus a true laser, which is still great if you're using it at home. I think LEDs are great for people to use for home therapy, but for using it in an office, I always go with lasers because it's like I had a Ford Mustang A V6. That'd be like me trying to enter my V6 into a Indianapolis 500 event, to where saying my Mustang's a race car, I can compete against these others. You just can't. So you want to use the appropriate type of a device in the appropriate situation. So I like using lasers in my office because of the improved effectiveness. I'll give you a couple examples. So I use Erconia lasers. Here's one of my handheld ones here. We have quadruple blind studies on our lasers to compare them to LEDs for autism. So we did a quadruple blind study on kids with autism, and doing 5 treatments. You were able to see improvements in behavior, in inappropriate speech, in function, etc. Versus with the LED group, there were no changes over 6 months. We have this for low back, also double-blinded studies, multi-site studies comparing for chronic low back pain, to where the effectiveness for chronic low back pain was 58% over 8 20-minute treatments with these lasers, versus with an LED, the reduction in pain was about 20% compared to the laser. But the key difference was with the laser, there were long-term benefits where even at the 1-year mark, patients continued to improve and had a 17% additional reduction with no additional therapy, versus with the LED, when you removed it, the pain started to come back. So there's some different ways that the lasers work. Lasers have what's called coherent light, to where it's coming in sequence. And when that happens, here's where the exciting stuff happens. So let's show you an example. When I get this laser here and I apply it on, say, my skin, it's going to create a whole signaling cascade in the body that happens. And you can actually get increases in stem cell production, increases in energy in the form of ATP. You can get increases in nitric oxide, also in glutathione, all these really cool things that happen. And with a laser, what happens is the laser can actually stimulate your cells to make its own what are called biophotons, which is to where the cells will start to release their own coherent light signals. So it gets the cells to talk to one another. And that's one of the unique things about laser that's not really talked about. Now, in the laser world, there's differences between high power and low power. So there's almost like a war in a sense. There's always like 2 sides to different things. They each have value, but they function differently. So a lot of doctors are focusing on, you got to go more power, kind of like Home Improvement in the 1990s. Tim the Toolman Taylor, hey, Al, you know what this baby needs? It needs more power. And they want to soup everything up. So more power can be beneficial if someone's working with, say, a arthritic knee, and they want to get a dose in there that's really high to cause what's called bioinhibition. And they'll use deep penetrating wavelengths, like in the infrared range, where they go into deeper penetration in there to thermally heat up a joint. A lot of these class 4 high-powered lasers that are out there, their FDA clearances, if you look at them, are for increasing topical temperature. Because that's what those types of devices do. They have a photothermal type of an effect. So you can get a quick drop in pain by increasing temperature. But those kind of devices, you don't want to use them on the head for any kind of like concussive or neurodegenerative types of conditions, because a thermal device is contraindicated on the head or near the thyroid, etc. So they can be good for those types of things. But I've used these low powered devices that are non-thermal, that work by what's called a photochemical type of a reaction. So when I get this laser and say I put it on my head, I'm going to stimulate things like brain-derived neurotrophic factor. I'm going to stimulate the formation of new blood vessels. I'm going to stimulate lymphatic drainage, all these different kinds of things that function in a different manner than, say, a high-powered laser. And the key really important thing here with, say, like this type of a laser is we have 22 different FDA clearances. So I have a head-to-toe clearance for treating chronic pain and inflammation with this device, versus other devices you might only have like one area, like, say, carpal tunnel, or just for temporary arthritic pain relief, etc. So that's a big difference. And as you mentioned, I just completed clinical trials on a new device that we got an FDA clearance for chronic neck and shoulder pain too. So we put our devices through rigorous double and quadruple blind studies. So that's a big difference in the different types of lasers that are out there. And we could spend hours really talking about that, but that's a summary of it.
Yeah. So can you touch on the different colors, different
Sure.
wavelengths? I know
Absolutely.
the longer the wavelength, the deeper the penetration.
Correct.
Infrared's going to go the deepest. But
Right.
when you treat, like you mentioned, treating the brain.
Yeah.
So is it more of a focal effect, or can you also use it, say, on the meridians of the body?
Yeah, so that's a great point that you bring up. That's an exciting thing that really is the direction that we're going into, and looking at the two different types of laser therapy. So you've got, say, in the infrared ranges where you're going to have that deeper penetration and a greater thermal type of impact and a local impact there. And one of the reasons why you have that is when you look at what we call electron volts, which means that when you look at wavelengths of light, you have individual photons, which are the individual like pockets of light energy that come out. You have different voltages for each one depending on the wavelength. So when you have those longer wavelengths, they're thought of as generally penetrating deeper, but they have less energy on them. So as a matter of fact, when you look at the energy of an infrared laser photon, it's down at about 1.49 electron volts. Now, what's key about that is that it falls beneath this threshold of 1.7 electron volts that's necessary to trigger electrons to bounce into higher orbits to create different electron transfer reactions. So with an infrared, you're going to get different reactions, which are more local and not as systemic. When you go into the visible wavelength lasers, you can get a greater systemic effect. So a lot of people say, well, how are you going to do anything with that? You can't penetrate as deeply. We look at studies going back to the USSR by Caru. We look at studies by Hamblin at Harvard and other studies out of Stanford. They showed that, as you mentioned, you can laser with a visible light source over an acupuncture meridian, over a peripheral nerve, and you can actually affect the brain, even though it's far away, because they talk about how these visible lasers have global or systemic effects is one of the things that you get. So if we look at, say, I have this laser here that's a combination violet diode and also red diode. The violet lasers have the highest energy per photon. They clock in at about 3.06 electron volts per photon. So that's double the energy per individual photon of an infrared laser. This is where some really cool stuff happens, is with that higher energy, you cause these electrons to bounce into that higher orbit and make these different reactions. And you also can get support versus viruses. So a lot of cool studies. If you go into PubMed, you can see violet wavelength lasers being used versus COVID. That helps to modulate the immune system, helps to provide support against viruses. Green wavelength lasers, they're a little lower in energy, about 2.33 electron volts, if I remember correctly. And those are great versus bacteria too. And they have some of the best effects to stimulate stem cells. And then if you go down to red, the energy is about 1.94 electron volts, I believe it is. And that's still high enough to trigger these reactions. And that can provide support against funguses. You get a lot of proliferation of different types of cells in the body. And you'll get sympathetic nervous system stimulation with a red. And with a violet, you get parasympathetic nervous system stimulation. So each wavelength has wavelength specific reactions. And that's what a lot of people don't understand is they'll say, oh, well, I read this study and talked about a violet laser. Well, I've got a red or I've got an infrared. I can do the same thing because a laser is a laser is a laser. And that's not true at all. The easiest way to think about it is if you go into a tanning bed, there's UVA, UVB, UVC, and they're all very close together, but very different. Some are extremely damaging. Some can give you a nice little suntan. So wavelengths can completely change what a laser is doing to the body.
And so, in terms of immune modulation,
Yeah.
is there a direct killing effect, or is it more modulating Th1, Th2, Th17?
So you get both types of the thing that's on there. So you have like let's say if you were to use a violet light outside of the body in a petri dish on viruses, you can actually cause a breakdown of the virus by exposing them to these types of light. So you get that combination. Plus, though, let's say when we're using the lasers on the body, you're not going to come in and just nuke everything like you do with antibiotics, because you do exactly what you said. You're actually getting a modulating effect on Th1, Th2, Th3, Th17. Plus all the cytokines. That's where the really exciting stuff happens. Is we look at violet and green and also red lasers. The research shows that these can actually help to support interleukin 10, which is the master regulator of the cytokine storm, and can actually downregulate interleukin 6, which is the bad boy that really kicks up that, like let's say with COVID, kicks up that cytokine storm that can be so dangerous. So you get a combination of both of those things where it does have a killing effect basically on these pathogens, but also more importantly supporting the immune system. And interestingly enough, we've seen that, let's say with the microbiome, if you use visible red lasers over the gut, even though it doesn't directly penetrate to it, It creates a signaling cascade and a photochemical event that can actually trigger regeneration of the gut microbiome. And again, people say, well, I can also do it with red light. Yeah, you can also do that. It's just when we look at head-to-head studies, the effectiveness of a laser is going to be somewhere in the order of 80 to 90% more effective in head-to-head studies that are out there.
Yeah, that makes sense in terms of the immune modulation and the killing effect.
Mm-hmm.
I've gotten a few IVs. The FDA cracked down on them. They came out with a new version, but it's called UVLRX.
Yes, absolutely. Mm-hmm.
And so,
Mm-hmm.
what I was taught by a few mentors is that pathogens absorb photons 5 times
Correct.
greater than our
Mm-hmm.
cells. And
Mm-hmm.
so I'll be honest, when I got that IV, I felt like Superman.
Oh, there's so many good studies on that. Yeah, absolutely. And it's a shame how slow the FDA can be to approve these things. Like I mentioned the autism study earlier, we submitted that to the FDA in 2018. Amazing results. The FDA said these results are too good. We don't believe them. You got to redo it. So we redid it and it's still sitting there. They haven't approved it. Meanwhile, they've approved some very risky medications that have a lot of side effects. So
Imagine
not
that.
surprised. Yeah, not surprised that you had a great result and then you slammed down on it.
Yeah. I mean, at the end of the day, they drip saline with it to keep the vein patent.
Mhm. Right.
But the light, I mean, it's just light. At the end of the day, I mean, it may only help marginally, but most people it helps tremendously.
Oh, it's amazing. No, there's and the research on that goes back to the Russians. So I have a book that's on all the Russian research up to like 1988, and they were doing stuff like that clear back then. That's how far ahead they were because they didn't have big pharma there. That's the I'm not an anti-capitalist at all, but it when you remove stuff like pharmaceutical influence and the financial influence, and you're looking at just data, you get different types of implementation on there. As you mentioned, things like for doing that intravenous UV stuff, we have a study that we did with the University of Illinois at Chicago on patients with chronic kidney disease with renal fibrosis, where we used a combination of laser wavelengths of violet, red, and green, and we were actually able to change the function of these kidney patients quite tremendously. And you can see different markers change on their tests, and each individual wavelength had different effects. Like the violet was the best for breaking down the fibrotic tissue because you have that higher energy, whereas the green was stimulating more of the stem cells and the red was stimulating proliferation of new kidney cells. So it's really cool if you can see that and dial it in and just look at the research and kind of pull away some of the marketing BS that can kind of be out there. And then the naysayers from companies like insurance companies who just don't want to pay for it, who try to say this is new and experimental, it doesn't really work, where we got tons of data on this.
Right. Yeah. So can you touch on how you got started into laser therapy and how
Yeah.
you moved away from just adjustments?
Yeah, well, it was 2004, and I was my 5th year out in practice, and I had moved from doing straight adjustments into doing like a lot of workers' comp. I was a qualified medical examiner out here in California, and things were going really well. And then Arnold Schwarzenegger got elected governor with the help of the California Chiropractic Association. He made a bunch of promises that he was going to support us and help us. And when he got in, he did the opposite. He terminated us. He signed this legislation that kind of carved us out of workers' comp for a while, to where it was really hard to make a living. A lot of offices closed out here because doctors had multiple clinics that went from having booming practices to you hardly couldn't get paid. So I thought, you know what, I need to like get into something that's not dependent on insurance, not dependent on the stroke of legislation. So I went to a Dr. Dan Murphy seminar, and if people don't know who he is, he's absolutely brilliant, like extremely intelligent. He's the kind of guy that he's kind of like talking to my friend Tatis Garagian. You ask him a question, they can quote a research paper they read 10 years ago and tell you the page and the paragraph that it was on, and they're not showing off. That's just the way their brain works. So Dr. Murphy was already doing lasers in 2004, and I had been reading about them in different journals, and I was excited about the potential, but I was broke, so I didn't have the money to do it. But I thought, you know what, I got to reinvent myself. So let me go to this seminar, and I go up to San Francisco, and there's about 120 people in this room, and when we walk in, they have this thing called the Myologic 8000, which would test your range of motion and your muscle strength with this computerized device. So you couldn't fake anything at all. They assessed our range of motion for the neck, shoulders, and muscle strength. And then they took the handheld laser, lasered the cervical spine. for just a few minutes and then immediately reassessed us. We didn't do anything, no activity, nothing, just laser to the cervical spine. And I saw changes in my range of motion and changes in muscle strength really fast. And I was blown away. I'm like, oh my God, if you can change range of motion and muscle strength, you have clear objective data. And every doctor in there, we saw changes in their range of motion and muscle strength. Dr. Murphy then was talking about how he said, even if you're never going to use this in your practice, he said, you've got to get a laser for yourself and your loved ones and use it on your brain every day. And because he was talking about the research already of how lasers could reverse neurodegeneration, it can enhance cognitive functioning. And this was 2004. Imagine this is how far ahead of his time he was.
Yeah.
So I jumped in and got lasers because I saw that as the wave of the future. And then I took additional training from Dr. Jeff Spencer. People may not know who he is, but they know who his main biggest client was, and that was Lance Armstrong. And Lance's name has gotten tainted now, but Lance did whatever he could to win, both legal and illegal. And Dr. Spencer used the legal techniques of lasers to enhance sports performance and muscle strength and function. And so I learned these techniques he would do on Lance and his team every day before they would race, that Lance credited with being a big reason why they won all those Tour de France victories in a row, because you can literally change the strength in a muscle in 5 or 10 seconds. And this is how I really built my practice, is these athletes coming in, unable to lift a shoulder, I'll test the muscle, I'll laser the muscle, I'll laser over nerve, because with these visible lasers, we're trying to affect cell-to-cell communication and neural communication. And they can see it change really fast to where they're saying, what kind of voodoo did you do on me right now, doc? Because I couldn't lift my arm and now I feel like I can go throw and play. And so that's why I got into it. Was I was also seeing not only the difficulty with making money through insurance, but also that I love adjustments. They're powerful. They're fantastic, but there's also limitations to it. And as patients were getting sicker, because I saw 5 years in, I was a better doctor. My skills were better, but I wasn't getting as good of results. And so that's why I realized I need to add some stuff in. That's when I got into like functional medicine to address the underlying, immune imbalances, food reactions, etc., functional neurology to see what's going on an inflammatory basis. And we use the lasers to basically affect the cell-to-cell communication to enhance the overall health of the patient. And that's the way I got into this.
Yeah, I remember in my doctorate program being shown several research studies that show interleukin-6, TNF alpha, interleukin-1 beta. When they attack cartilaginous tissue, it degrades it.
Exactly.
And so, right there, you have benefits for every joint, the spine, the disc. So that's pretty cool. What?
Yeah.
Go ahead.
Yeah, and what I was going to say, the one that really kicked it off for me, that made me glad I got into lasers, was right after I got it. I had a patient come in who was a 16-year-old girl, and she had been a homecoming princess and was on the back of the float. And the teacher who was driving the float thought it'd be funny to, do the quick stop and start and make the kids fly around. And they're laughing. But since she's in heels, she rolled her ankle and got an ankle sprain. So she goes to Kaiser over here outside of LA, and they check her out and they said, all right, you got an ankle sprain. It's going to be 4 to 6 weeks, rest, ice, compression, elevation, be on these crutches and you'll be fine. 6 months later, she's in my office. She's been at Children's Hospital in LA. They can't figure out what's going on with her because she still can't put any pressure on her foot. She has to cut off her pant legs on the right because she can't handle any material on her at all. And her leg is purplish red to the mid thigh. It's cold. And they said, we don't understand why this happened after a small ankle sprain, which that blew me away, because this was one of the test questions we had on the national boards, is that you can get a small injury and it can cause the nervous system to go haywire. It used to be called reflex sympathetic dystrophy. It's now complex regional pain syndrome. But at Children's Hospital in LA, they couldn't figure out what was going on. And they told her, well, we don't know what's wrong, why it's happening, but you're losing blood flow to the leg, so you may get gangrene. So what we need to do is a mid-thigh amputation. So imagine she's 16 and she's looking at a mid-thigh amputation. You think about how the rest of her life would go. And they're in my office giving me the Princess Leia, help me, Obi-Wan, you're my last and only hope in the office. So no pressure there, right? If I can't help her, she's losing this leg. So I just got my lasers and they said, do you think you can help? I said, I don't know, but I know that Dr. Murphy said that lasers have a global effect. We can dampen inflammation. We can alter nerve function. Let's just try it and see what happens. So I hadn't taken functional medicine or functional neurology seminars yet. So I just thought, well, let's get the lasers on the area of involvement. And this particular laser has a cool line generated beam to where you can spread it out over a large area, so we don't have to directly apply it. And so I applied it there and also in the low back. And if I were to do this today, I would also put it on the brain. So I did this and had her just do little rehab exercises, like small movements in the range of motion that didn't affect her, didn't cause increased pain. And then we do little hot and cold stimulation and a cotton swab. And we're able to reset her nervous system. And in 3 weeks, she had a complete resolution of her symptoms when she had been horrible for 6 months. Now, the interesting thing is she walks into Children's Hospital under her own power, and they see her and they're like, wow, you're looking great. She said, yeah, I went to this chiropractor. He did low-level laser therapy on me and adjustments. And right off the bat, what do you think the doctors at Children's Hospital said? They're like,
Oh, that's just coincidence that it healed.
"Mhm." Yeah, they said yeah, lasers are BS. There's no research on it. And yet you either had a spontaneous recovery, basically a miracle, or we misdiagnosed you. But hey, good thing we didn't cut your leg off, right? So so she had this recovery. The cool thing is she became my receptionist for a few years. So when patients would come in and say, hey, does this laser stuff really work? She'd stand up and show them her leg and say, you see my leg? I have my leg because of my lasers. And that was the one that kicked it off for me of really doing some changes with lasers. And then the next one was my cat got acute necrotizing pancreatitis, and I wasn't aware that we could do things with that. But Russian research, they were already regenerating liver tissue back in the 70s. But my kitty was like our fur baby, and my wife and I came home one night and he was just limp on the ground and unresponsive. And I don't know about you, if you have pets or have you had pets
Yeah.
before?
Yeah.
Do yours get sick during normal vet business hours, or is it on the weekends and holidays like mine?
Yep.
Yeah. So this was a weekend at, like, 1 a.m. We had to rush him to the emergency vet. So you're in for like a grand over there. And I take him in, we set him down, and the vet looks at him and says, "Whoa, your kitty's pretty sick. Let's take him back and run some tests." So they do this and they come back and they tell us, we got bad news. We did an ultrasound on his pancreas and ran some labs, and he's got acute necrotizing pancreatitis. And I said, well, how does a cat get this? He said, well, we normally see this more in dogs, where around the holidays they'll eat fatty foods and it can trigger this autoimmune attack of the pancreas. And he said the unfortunate thing is we don't have a treatment for it. We recommend that you put him to sleep because he's got 90% destruction of his pancreas. And I was just floored because I'm like, how do we go from a good night out where we're at the local Indian casino here in Pachanga, seeing a concert and gambling, and now I'm looking at putting my kitty to sleep? And so he's telling me, no, well, you got to put him to sleep. We don't have anything for it. And I said, well, you know what? I'm going to take him home. I'm going to try using my lasers on him. And the vet gives me that Robert Downey Jr. meme look, rolling his eyes. He's like, listen, your lasers aren't going to work. Nothing's going to work for him. And I said, well, you want me to put him to sleep now? I'm going to take him home and try. What's the difference? I mean, I can try for a few days. He said, all right, fine. He said, well, here's what you got to look for. He said, today's Sunday morning. By Wednesday, he'll be yowling. He'll be in a lot of pain and he won't want to eat. So that's when you got to do the humane thing and bring him back in and put him to sleep. So I said, all right, fair enough. So I take him home. I start lasering over his kitty pancreas. This is where you'll have some naysayers who say, oh, well, a visible laser, it doesn't penetrate through fur. We have double-blind studies that got FDA clearances to show that it does penetrate through fur, but this anecdotal story will show you how it also does. So I did it over his pancreas. And what happened was each day I did it twice a day for about 5 minutes each time. By Wednesday, he's up, he's moving around a lot. He's got a good appetite. He's more energetic, and each day gets better. So I take him in for a follow-up on Friday, and the vet looks at him when I set him down. He's like, wow, your cat looks surprisingly good, but hey, don't get your hopes up. We're going to do a follow-up ultrasound, and he was at 90% destruction. If it's worse, we're going to need to, do the humane thing and put him to sleep. So I said, all right, fair enough. So he takes him back, and I can see him through the little, window in the treatment room door. I could see him looking at the ultrasound, comparing. He's scratching his head, calls over another doctor. They're discussing it. They're scratching their head, and they look back and they see me, and he waves me through the door, and I come in and he says, what the hell did you do? And I asked him, I said, well, why? What's wrong? He said, no, nothing's wrong. He said, well, what the hell did you do? He said, here's his old ultrasound, and here's this week. He said, I had to make sure this was the right film because he said, here he is. He said, this was the worst pancreas we've ever seen in our practice. And he said, I got to be honest with you. When you left, we all thought about what a crazy a-hole chiropractor you were, thinking your magic lasers were going to heal your cat. He said, but here it is a week later, you regenerated 80% of his pancreas in 1 week. He said, we've never seen this before. We didn't know it was possible, but what did you do? So I told him, well, I used my lasers on him. Now, the difference with the vet than Children's Hospital of LA is the vet took down the notes. Next thing you know, he's got signs up for lasers. He's lasering dogs, cats, chickens, pigs, snakes, everything that people are bringing in because he's seeing that these huge changes there. They saying, well, your cat's out of the woods with pancreatitis, which is great. He's never seen it before. We're going to start doing it. He said, the bad news is he's now diabetic. He's going to need 4 units of insulin twice a day, which he's going to go through about 3 vials a month. They run about $120 a vial. This was in 2008. That same vial is like $600 now. So showing you how expensive it is to be a diabetic. It's insane. But so anyway, he says the other bad news is he's only going to live like 1 or 2 years because eventually his insulin receptors are going to burn out and that medication won't work anymore. He's going to keep needing more of a dosage. So you can expect your kitty to become the $6 million kitty to where it's going to be more expensive to have. So I said, all right, fair enough. So I take him home. I keep lasering him on his pancreas. And then I switched his diet. I made him like a kitty carnivore diet, like you do with a human, remove the grains, everything else like that. And what we saw was I would test his paw to see where his blood sugar was. He went within 6 months from needing 4 units of insulin twice a day to where he would need 3, then 2, then 1, then 3/4 twice a day, then once a day, then once every other day. And I would manage this with the vet, and he was amazed at how well he did. And instead of having to go through multiple vials a month of the insulin, we'd have one that would last 6 months. And my kitty didn't live just 1 or 2 more years. He lived 6 more years to the age of 17.
Wow.
So we see these crazy things with lasers, that both from anecdotes and from these double-blind studies. And that's when I got into it. And in this book here, you can see Russian research talking about they did this with liver cirrhosis. They've done it with all different kinds of tissues. They do it with treating the eyes for diabetic retinopathies. We've seen it with the kidneys. So it's just, there's so many different things that you can do with the proper wavelength and the proper type of an energy.
Yeah, I'm always floored at both human medicine and veterinary medicine, how quick they are to jump to amputations.
Yes.
Anesthetizing an animal. I was always taught, you start with the most conservative therapy and then you gradually work up if there's no clinical response.
Right.
But now it's just like, let's just jump to surgery.
Yeah.
If the only tool in your toolbox is a hammer, everything looks like a nail.
Yes, exactly.
But trying to amputate a 16-year-old, that's pretty severe.
It's insane. And you think about, that's where I think about, when I first was introduced to lasers, again, I was rebuilding my practice. We were going through a tough time financially because our stream of income from workers' comp was gone. It was a big leap to buy this $15,000 laser at the time. But I thought, you know what, this is the wave of the future. This is what I really got to do. And I think if I hadn't have bought it, if I would have hesitated because of the price, Teresa comes into my office, she loses the leg. My cat, we have to put him to sleep, and we have tons of stories of things like this to where we use lasers and completely change a person's life. Autoimmune Hashimoto's patients, there's a lot of cool research on lasers being able to help these patients too, and concussed patients and patients with neurodegeneration. Like the list goes on. It starts to sound like snake oil because there's so many things that you can do with it, but it's exciting to see the changes you do in people's lives.
Absolutely. Can you touch on the vagus nerve? There's been an explosion of devices that stimulate the vagus nerve, either on the ear or using piezoelectric current on the sternum. Can you touch on whether lasers can help the vagus nerve?
Yeah, absolutely. Absolutely. And that's a good way for your listeners to test if they have an issue with the vagus nerve or someone in their family does is look for certain things like this. Definitely you can just go, in the mirror and see if the punching bag, the uvula, does it elevate and does it do it straight up or does it deviate? If it does, you can have some different issues going on there. If a patient has difficulty swallowing towards the end of the day, like eating, they're like, oh my gosh, I can't swallow very well, or chronic constipation. Those are all signs there could be a vagus nerve dysfunction. Those are some simple ones there that if you got that going on, you may want to do some work with your vagus nerve. So one of the things I learned from Dr. Karazian is there's simple low-tech ways you can stimulate it, like just gargling hard for a minute, just and try to make the water fly as much as you can, stimulate the gag reflex, singing loudly. Those are a few simple low-tech things that you can do. Now, when we do these and we stack laser, yes, you get a synergistic, really, really great effect with that. And we have studies, particularly on this device here, this EVRL, which is a red-violet combination from Marconia, where Dr. Calixto Machado, he's a medical doctor and a researcher out of Cuba, he took our lasers and did studies using quantitative EEGs to show a change in vagal nerve output and also in general brain function on there. And so he showed by taking the laser and lasering over the vagus nerve that you can actually change the vagal tone and also even the function in the brain with quantitative EEGs. So what we do in my office is I put them under a device called the FX635, which is 3 rotating visible red lasers. That's the one we have, did the studies on autism. So I put that on the brain. I'll have them do the gargle exercise while I laser with the red and violet laser over the vagus nerve. Now, one of the reasons why I really like using the red violet combination on there is because then you have parasympathetic and sympathetic stimulation that the body's going to take that energy in and self-balance, kind of auto-correct that little seesaw between the two things there. I also like that the violet wavelength has that antiviral, antimicrobial type of property, because we now know that a lot of bugs will start off in the gut, crawl up the vagus nerve, and then just set up shop in the brain and trigger inflammation that can lead to protein misfoldings and tangles that lead to neurodegeneration. So I discussed this approach with my good buddy Dr. Datis Karajan when I was doing his functional neurology courses, and he's like, "Yeah, this sounds like a great idea, stacking the lasers." He had me present using lasers for brain issues to the International Association of Functional Neurology and Rehabilitation back in 2017, because he saw this as a wave of the future as well too. So we'll do this with patients, and what's really cool is we'll have patients sometimes who won't be able to swallow. Like, here's another sign: if a person needs liquid or powdered supplements because they can't swallow pills, there's probably a vagus nerve and a brain issue going on, a warning sign for neurodegeneration. So we'll use that as one of our outcomes, and we'll have the patient do the gargle while they're under the lasers. And we've seen patients start off trying to gargle like this, being where they can't really do it, and in a few minutes of doing it with a laser, they're actually able to start gargling, and then they're not aspirating their food as much. Their digestion can start to improve. You can see constipation change. It's really, really cool stuff.
That's awesome. So the Erconia is the main laser that you use. And
Correct.
can
Yes.
you select, I know you mentioned a red violet combo.
Yes.
So there's different programs that include different colors.
Yeah, so different lasers will come out. So like this one is called the EVRL. So one diode is red, one diode is violet. This is currently the only one in the world that has any FDA clearance at all. And we have specific power settings on here too. So I do want to touch on this because people will think that, oh, well, you got to ramp up this power to make it more effective. So like with the violet diode we have here, it's only at 5 milliwatts. There's a specific reason we do that, because according to the research, because remember that violet wavelength I mentioned has the highest energy per photon. You want to make sure you don't overstimulate people, because with lasers, there's what's called a hormetic curve, that if you go in too high of a dosage, you can actually get opposite or negative effects. Or if you try to push a dosage into the body too fast, you can get the opposite effect. It's kind of like if you want to slow cook ribs versus microwave ribs. You can put the same energy into them, but when you do it in a short period of time versus long period of time, you can get a completely different output on there. So like there are some people who are thinking, well, if I ramp up, say, instead of this being 5 milliwatts, if I make it 300 milliwatts, it's going to be 60 times more effective. And there's literally a device they're trying to have come out do that. I'm concerned. I don't care about competition. I'm concerned about patient safety, because if you take that energy and make it 60 times more energetic, you can literally get some pretty bad things that can happen to a patient. So that's why we have specific wavelengths, specific energies that are based on research studies that we've done to figure out, hey, what seemed to be the most effective milliwatts on there? Well, this one seemed to do it as we experiment with higher or lower than we found the Goldilocks zone on there. So we have this one that has the red and the violet. There's other ones that are just dual red. That's less expensive because the violet diodes are just more expensive to produce. Right. They're not made as much, and so that adds an extra cost to it. So those are set in there, but we can change the frequencies, because let's say if I have a patient who's really anxious or had a fresh concussion, if I make the laser pulse at 1 hertz, it's going to have a calming effect on the brain, and we can actually bring them down. If I've got someone who's got, say, Alzheimer's, for example, if we pulse it at 40 hertz, which we can't really see it, it's going to look just like a continuous solid beam. But if we pulse it at 40 hertz, it can trigger a breakdown of amyloid beta and tau protein, according to research studies too, that show that particular frequency will do that. If we got a broken bone, we put it at 2 hertz, that can actually stimulate the bone to regenerate. If we got like a essential tremor or Parkinson's, 133 hertz has been shown to be effective. If someone's got acute pain, 4 pulsations per second has been shown to be effective for that. For chronic pain, it's 60 hertz. So it's really cool, all these different kinds of frequencies that will affect differently. If someone's got peripheral neuropathy, the best wavelength, according to research studies, is 532, which is green. So there's all these different things that are out there that are really cool that you can do with different wavelengths, different frequencies.
Yeah, and so with the Erconia, you said the violet diode and the red diode. Can you also do green?
So green, currently there's no green one yet out on the market. That's one of the things we're doing research studies in. I've been involved with some research studies on that. So, but we don't have anything out. That's something that hopefully in the future we'll have that coming out, because that'll be exciting to have something like that. Like as we're able to show in those studies they did at the University of Illinois, the combination of the 3 wavelengths were really effective. So they're constantly doing research on what effects different wavelengths have. So, it'll be exciting once they do have something like that come out.
Absolutely. So kind of going back to the systemic versus the local
Mm-hmm.
or focal effect. Let's
Yeah.
say, I'm squatting deep, with
Mhm.
225 pounds. I
Right.
tear the medial horn of my right meniscus.
Yeah.
Is there benefit? I know class 4, a lot of people use that,
Right.
but can this also regenerate cartilage?
Yeah, it can. And if you look at the research studies too, and this is, again, I always tell people, don't even listen to me. Don't listen to anybody, fact check everybody, but do it in the legit way, not the Facebook way. Go and look at research studies and look at different, because there's so much misinformation out there. I encourage anyone to look at the website of whatever laser or LED device they're looking at and look at what research do they cite. So for example, we see certain high power companies will critique the lasers that I use, but then on their page, they'll cite the research we've done to support their laser that's completely different. So you want to look at that, look at what research they actually cite, look at what are their FDA clearances and what are they specifically for, because if you look at the bulk of the research, so in this book here, this even says the bulk of the research is on the lower powered class 2 and class 3 lasers. Class 4 are newer. They work on a different, more of a photothermal type of an impact on there. So you get really quick types of pain relief, and they do have their benefits, but that you get more of a bioinhibition when you go with a higher dose. When you push that in with higher wattage, you push the dosage in at a faster time, and the body will have more of a bioinhibitory response, which can really quickly dampen pain. When we use, say, these visible lasers, there are studies showing that it actually even has an impact on the discs. So there's one particular one that was on violet, green, and red wavelength lasers that don't directly penetrate to the disc. But what they'll do is they'll stimulate these things called extracellular matrix modifying enzymes. And these enzymes will actually migrate to the disc to repair the tissue. So you get these systemic effects, and that's an independent study too. So people can do a PubMed search on that, on a low-level laser affecting the annulus fibrosis cells by stimulating extracellular matrix modifying enzymes. And they can read this study that was done on that using the low power visible wavelength actually triggered the repair, to where the conclusion was is that these low power devices can be used to actually repair the disc. That's not about just pain relief. And that's the difference, is look at what are the long-term studies that are on there. And as I mentioned before, on our FX635, we have long-term studies with patients who had 8-year minimum duration of their of low back pain, that we use the lasers on them, and it actually repaired the tissues because of the systemic effects that you're getting. And remember too, when we get a laser on the body, a lot of the energy is getting picked up by the bloodstream, that gets transported everywhere. That's why one of the things we like to do is to activate whatever is injured. So if it's a hamstring, we have them do hamstring movements to their tolerance while we're lasering at the same time, because then the blood vessels pick up that energy and you can deliver it to the tissues. You also have, let's say with the violet wavelength will perpetrate through the water in the cells too, which, because basically water is transparent to violet light. If you look in the ocean, violet and blue light penetrates the deepest because it goes through the water molecules. So when we've got living tissue, the violet wavelength can actually go deeper than anything. If you're looking at a slab of dried meat with no blood flow and with no water in it, then that's where the infrared goes, actually the biggest on here. But because of the systemic effects and the way it goes through the water molecules, you can trigger things to go deeper with these ones. And there's a fascinating thing that occurs too, especially with the violet one, is when you excite these different types of electrons, and then when they drop down, they'll stimulate the cells to release their own biophoton. And the coherent light from a laser, this is where an LED is different, because you don't get this effect, but coherent laser light, like especially in the violet wavelength, it can actually excite these biophotons, and these will propagate through the myelin sheaths and through the microtubules and the mitochondria, and they'll propagate at the speed of light. So you get instantaneous communication throughout the whole body that's more unique to the visible light lasers because of having that higher electron volt on there that you don't really get with the infrared. I'm not saying that to knock infrared or high power. It's just you have different usages. And there's a lot of misinformation saying that, oh, you can only use these lasers for dermatological types of impacts. But we have the studies that show that that's not the case. We have functional MRIs showing that a violet wavelength through functional MRI and also through quantitative EEGs can change brain function on there to really cool levels.
Now, for like, let's say you have a patient who has great benefits from your treatments with the laser,
Yeah.
and they're moving to Missouri.
Yeah.
Is there a home version that they can purchase?
So they can actually purchase the clinic version. I've had that happen where patients have moved out of state, and we'll try to hook them up with a doctor in the area. But sometimes they'll be like, hey, I just want to continue these protocols at home. Or let's say if I've got a patient who's got severe chronic neurodegeneration or something where they really need to do this every day at home, I can write a prescription. Like a doctor can write a prescription for them to purchase the laser. They can purchase the laser to have it at home and then use it on a daily basis. And let's be realistic. If one person in that family has neurodegeneration, there's probably a genetic component. So it's probably a good idea for everybody in that family to use the laser on a regular basis. So we'll oftentimes present that to a person saying, hey, going forward, or especially if you test them and let's say they have the APOE4 gene, for Alzheimer's. Hey, you guys have this genetic marker for this. You don't want to wait until you have symptoms. I recommend you get a laser. You're going to save money in the long time. These things last forever. They're like Tonka toys. You just don't break down. You can have this forever. You can do the treatment on everybody in your family and save money in the long haul. Because since these are class 2 lasers, there's misinformation out there where people think that class 4 means it's better. It just means it has a higher risk, is what it means. Higher risk of damage to the eyes, higher risk of thermal damage. Class 2 is so safe, we don't have to wear eyewear. We can actually, if you get flashed, you're not going to burn the retina or anything like that. So we can legally prescribe these to patients to use at home, whereas a high-powered device, you can't do that because they need doctor supervision. Usually both parties have to have the glasses on.
Gotcha. What is one thing or what are two things that you know today that you wish you knew 8, 10, or 12 years ago?
So what I wish I knew 8 or 10, 12 years ago was how important it is to do the laser regularly on the brain. Just because if we look at the rates of neurodegeneration, how that's skyrocketing, and just autism, all these different kinds of things in kids, especially in a post-COVID world. So we look at the research my buddy Dr. Karazian did showing that the spike protein, either through infection or through mRNA vaccination, can trigger autoimmune reactions. I wish I would have known 8 to 10, 12 years ago, the importance of using these lasers regularly on the brain to stimulate stem cell production, brain-derived neurotrophic factor to help regenerate tissue, and to help calm down autoimmune reactions on there. Because I think there were a lot of patients back then that I could have helped that I wasn't really aware of it because I wasn't using the lasers on the brain quite as much as I was back then. And the other thing I wish I would have known also is how you can use these to impact the gut-brain axis, the bidirectional pathway, how you can use it to try to repair leaky gut, leaky brain, and the microbiome. Those were a couple of things that just once I saw the research on, I'm like, my God, there's so many things I could have been doing when I was really focusing more on just a musculoskeletal sports injury practice of like, hey, we're going to use lasers to enhance your performance, which was great. We helped a ton of athletes, set world records, win championships, etc. But I think of the average patients who are coming in with just some autoimmune types of things or chronic fatigue or etc., that using those lasers, even if I don't know complex functional medicine, functional neurology, just laser on the brain, laser on the gut, you can do so much stuff with that, so much power there.
Absolutely. So if a listener wants to get in touch with you, possibly come to see you, where should they reach out to you?
They can go online, Laser Chiropractic, and that's laser with an S.net, laserchiropractic.net. If they Google me, they're going to see I come up in tons of podcasts, summits, etc. on there. But that's the best way to get in contact with me. Also on Facebook or Instagram, just typing in, Dr. Kirk Gair. My name's a very rare Scottish name, so it's easy to follow me. There's not many Dr. Gairs out there. And if they just, do that, they can contact me there.
Awesome. Well, you've been a wealth of information. Really appreciate you having you on the show. And thanks for the work you're doing.
Thanks,
you're
Tim.
definitely being a lifelong learner. You're not just resting
No,
on your
constantly.
laurels.
I'm
So,
constantly reading. My wife says I'm obsessed. I've got like an obsession with just reading about lasers, ordering rare books to read other research stuff that was available in Russia, not available here. Yeah. Because I want to do this in the way that's the most scientific, legit science, not like the science we've seen over the last couple of years.
right,
Look at what are the quality types of studies out there.
right. Awesome. Well,
Yeah.
thanks, Kirk. We really
Thanks,
appreciate
Tim.
you, and hopefully we can have you on again in the future.
Absolutely. I'd love to do a follow-up.
All right. Have a great rest of your day.
Thanks, you too.